I believe that one of the most important services that we provide in our practice is teaching our patients the skills necessary in order to prevent future dental and periodontal disease. In order to be able to do this, a patient needs to be effective in their home care. Effective means that when you're done doing what you're doing, you have removed all the plaque from every surface of every tooth in your mouth. Dental plaque is a film of bacteria and waste products that forms on the teeth within 12 to 24 hours of a professional cleaning or after effective brushing, flossing, home care at home. Unless you master the skills necessary to prevent that plaque from reforming on the teeth, then it is very difficult to prevent future tooth decay and periodontal disease. And periodontal disease is the leading cause of tooth loss in this country. So what do I mean by effective? Effective means that when you're done doing it, you have removed all the plaque from every surface of every tooth every time. So how do we do this? We're going to show you now a step-by-step approach in how to properly take care of your teeth. The objective is to remove all the plaque from every surface of every tooth every time. There are 5 surfaces of teeth that need to be addressed. There is the chewing surface, which is generally easy. There are the cheek sides, which are generally easy, although sometimes in the back here people miss, and believe it or not, right down here in the lower front people oftentimes miss because they keep their lips too tight when they brush. The insides of the teeth start getting harder, especially the bottom back teeth. If you notice on the model, the back teeth have a tendency to tilt in towards the tongue. And most people, when they're brushing, end up being just short of that gum line. And then we have the in between the teeth, and this starts getting a little bit harder for everybody. So what we're going to do now is just kind of methodically go through and show a step-by-step approach for addressing all of these surfaces. The first thing we're going to do is we're going to show the proper way of brushing. We highly recommend a soft toothbrush with rounded bristles. Some of the off-brands are made with cut bristles and they're sharp. Your name brands like Oral-B or Crest or Colgate, those typically are appropriately made. It does not matter really which kind of toothbrush you use, but just a regular plain one. You don't need one of the fancy ones. We highly recommend power brushes. And for power brushes, we have, for example, the Oral-B's with this particular brush head. It's called the Precision Clean brush head. Sonicares will work as well. They have advantages in people who have kids who have braces, adults who have braces. But sometimes these are a little bit harder to use, especially on the inside of the back teeth. And so our office preference is the Oral-B with the Precision Clean head on it. Okay, when brushing with a soft toothbrush, the appropriate way to position the toothbrush is at a 45-degree angle to the tooth and gum. Make a series of circles so that the bristles get under the gum line and loosen the plaque, and then sweep away from the gum and repeat. So a little circle and a sweep, a little circle and a sweep, overlapping, bring the brush forward, and keep going. On the inside, it's going to get a little bit more difficult. In order to properly do the inside, you have to make sure that you reach down deeply enough to reach the gum line. Brushing the inside of the lower back teeth is difficult because it's hard to reach. And for a left-handed person, the inside of the lower left is going to be the most difficult. And for a right-handed person, the inside of the lower right is going to be the most difficult. Why is this? Well, when we watch people brush, most of the time when people are brushing, they have their elbows pinned to the rib cage. And so they're brushing along and they're brushing along, and then they go to do that inside and the angle's wrong. So in order for a right-handed person to reach the inside of the lower right properly, you have to lift your elbow up, cock your wrist back, and it's going to feel like that brush head is reaching almost under the tongue. But the motion here is the same. So 45-degree angle, little circles and a sweep, little circles and a sweep, overlapping, bring the brush forward, and keep going. On the inside, on the bottom, it's the same idea, but sometimes there isn't enough room here to fit the brush horizontally. When that's the case, then use the end of the brush and do each tooth individually vertically. On the top, you're pointing up at the gum and sweeping down. The inside of the upper back teeth will be easier to reach than the inside of the lower back teeth, because these upper back teeth, they actually flare out. So this gum line is going to be easier to reach than that gum line is going to be. When you're done, make sure that somehow, some way, you get behind the very last tooth. And sometimes in the back, the only way to get back there is to come in from all the way across. Now, once you've gone all the way around, you can gently scrub the chewing surfaces. And if you must, you can gently scrub the flat surfaces, but you want to be careful to never scrub along the gum line with toothpaste, because scrubbing with toothpaste with any kind of force is going to recede the gum and it's going to start to notch the necks of your teeth. Now, as I said earlier, we highly recommend the power brushes. And why we recommend the power brushes is because they are much easier to use than manual brushing. So let me show you how. Power brushing is much easier. All you have to do is put a little bit of toothpaste on this, put it in your mouth, turn it on in that order. Position the toothbrush so that it's at a 90-degree angle to the tooth and to the gum. So with a hand brush, the positioning would be at a 45-degree angle. With a power brush, it's at a 90-degree angle. And the trick here is to get it in position and pause. 1, 2, 3, 1, 2, 3. Just tooth by tooth. Just bring it along and let the brush do the work. The mistake people make with these power brushes is they go in and they brush with them as though they're hand brushes. And they're not designed to work that way. They're designed to be placed and allowed to do the work themselves. On the inside, everything is the same. 90-degree angle, pause, count to 3, and just drag it along the gum line. Now, if you notice the way I'm using the handle, the brush handle is parallel to the floor. On the outside, if we notice, I'm holding it this way, and I'm not holding it this way. And the reason why I'm not holding it this way is because of the way these brushes are made. If you notice, I'm trying to get this focused, these brushes on the lighter blue brushes are longer than the darker blue. And these are designed to sort of go a little bit in between your teeth. And if you hold this the wrong way, if you press the gum with those long bristles, then it will recede your gums. So be careful, make sure you're positioning this the right way. So again, we want to hold it this way. We don't want to hold it this way. As I mentioned, Sonicares can work as well, and they work exactly the same way. 90-degree angle, Pause in each position for a count of 3 and just kind of work your way around the arch. The disadvantage of the Sonicare is on the inside. And the problem with it on the inside is as you come around, the length of the brush head is such that a gap forms right there. And it's difficult to clean this area right here with the Sonicare brush. So what you have to do is just kind of drag it along as you come across in there, and that can be a little bit difficult for people. But this is an effective toothbrush as well. I just find it harder to use. So toothbrushing is going to remove plaque from 3 out of the 5 surfaces of the tooth. The cheek side, the tongue side, and the chewing surface. But it's not going to remove plaque from the inside. So in between the teeth, we still have to rely on dental floss. Now it does not matter what kind of dental floss you use. Waxed, unwaxed, tape, glide, it does not matter. The correct floss is the one that you'll use regularly. And the problem why most people have difficulty flossing is, in my experience, has been that really no one has actually shown them how to do it. So we're going to show you how to floss properly right now. When flossing, take a piece of floss that's about 1.5 feet to 2 feet long. Take the end piece and just loosely start wrapping it around the middle finger. Now you want to do this loosely because if you do it too tightly, you'll cut off circulation in the tip of your finger. On the other hand, grab the end and get enough loops in there to anchor the floss. When you're flossing, your hands should be about 4 to 5 inches apart. Start making a fist and come over the top with your index fingers. Most flossing is going to be done with fingertips. You're not going to get 4 fingers with floss all the way back inside the mouth behind the last molar, but you will get 2 fingertips back there. So let me now show you the proper way of flossing a tooth. First of all, behind the very last tooth, or when there's gaps, it's a little bit difficult to floss. So when you have a tooth like this that does not have a tooth next to it, loop the floss behind the tooth, and here just gently buff horizontally back and forth. You want to get under the gum line, but you want to be careful that you don't cut the gum. You can also flick the floss vertically, and you can do a combination of a little bit of horizontal and vertical. It's kind of a challenging area to floss. Between teeth, flossing changes. Gently snap the floss through the contact. Take your fingertips and push them past the tooth so that that floss bends, wraps, adapts to the tooth. And now, from the contact down under the gum line vertically, scrape up and down 4 to 6 times. Now, without pulling the floss out, pull your hands forward, wrapping the floss around that tooth up and down 4 to 6 times. Floss. Remove the floss, unwrap to a clean area, and then go to the next surface. Now we see people do this a lot when they're flossing. They just kind of pop the floss in and out. Okay, that is not the correct way to floss. That is kind of what dental hygienists do after they've polished your teeth. But they're not flossing. What they're doing is they're cleaning the contacts between the 2 teeth, and they're moving the paste that was in there out of there, but they're not correctly flossing. So again, through the contact, push on that tooth, scrape up and down 4 to 6 times, pull on that tooth, scrape up and down 4 to 6 times, and move on. Now flossing is great in health, in gingivitis, in early bone loss. When a patient now has moderate or advanced bone loss, flossing is not as effective. And why? Because as bone loss occurs around the tooth and as a pocket around the tooth gets deeper, As you go deeper and deeper into that pocket, the root of the tooth increasingly becomes grooved. And if you take floss and you stretch it across a grooved surface, the groove doesn't get clean. And the disease just sort of progresses down the groove. So to get between the teeth in those types of situations, you need a different tool. And that's where we get into these what we call interproximal brushes, or the brand we use is called a Proxa brush. The Proxa brush is basically just a little brush. It looks like a little bottle brush. And it's inserted into the handle through the little hole that's right there. And what you do is you kind of carefully put the wire into that little hole. There's a groove where the wire goes into, and then as you lock the brush head into place, it will secure the brush, the Proxa brush, into the handle. The way you use this is basically like this. Where this brush fits, and it's not going to fit everywhere, you simply push it in between the teeth and 4 to 6 times brush. Pull it out, go to the next one, 4 to 6 times brush. Now if you notice, try to do this so you can see it, when you're doing it from the cheek side, the handle is pretty much straight out of the mouth. 4 to 6 times in and out. When you do the same space from the inside, because of the bend in the handle here, the handle is coming out almost the opposite side of the mouth. So the problem that people have with this tool is they can generally do the outsides pretty well, but then when they go to do the inside, typically they have the handle too straight out of the mouth, and it either doesn't go in, or they poke themselves, or they bend the wire and they get frustrated. So if it goes in from this direction, it will go in from this direction as well. If it's not, just keep bringing the brush handle over and over until it finally slips in. Now once it's in there, do your 4 to 6 repetitions and then pull the brush all the way out before you try to go into the next space. You do need to do both the inside and the outside because the spaces here on the inside are wider than they are on the outside. Now these Proxa brushes are not durable. If there are several spots in the mouth where it fits and you're using it, you will get a week and a half to 2 weeks use out of this. And what happens is then the bristles start to mat down and kind of get flattened out. Do not put toothpaste on this. Putting toothpaste on this will crush the little fibers and you will not get much use out of this at all. These come in refills. Typically the pack of refills has about 6 or 8 brush heads in them. They are getting a little bit harder to find, but you can find them online easily. And they are Proxa brushes by Sunstar Gum Butler, one company with 3 names. These are very useful to use when patients have experienced bone loss in between the teeth. So at this point, we've shown brushing, flossing, and the proper use of an interdental brush called the Proxa brush. These are for removing plaque from the 5 surfaces of the tooth that I mentioned. Now we're going to introduce one last instrument, and this instrument is for the gums. This is a rubber tip stimulator. This is probably the most important tool you use to get rid of bleeding from the gums. When I do my consultations with patients, I kind of make a big deal about bleeding gums because you have to have bleeding in the gum before you have damage to the underlying bone. And it's very difficult to get rid of the bleeding without using this tool. This is a firm rubber tip. This is firmer than the ones that come on the ends of toothbrushes. And it has the shape and the size that we find works the best for our purposes. Let me show you how to use this. The way you use this is you start in the corner and you get the point of the rubber tip between the gum and the tooth. And you lightly trace. When you get between the teeth, put it in flat, push it in as far in between the teeth as it goes, and 4 to 6 times rock up and down. Gently trace with a little bit of firmness, rock. Trace and rock. You want to trace lightly because if you trace firmly and slip, you'll cut the gum. So the tracing keeps you in contact with each tooth, and the objective is to learn how to do this by feel. The rocking motion is the main benefit of this tool. A couple of points on rocking. When you're rocking, the tip is actually lifting off of the gum, like this. You're not doing this. This is poking. Poking will hurt. If you press too hard, you will damage the gum. If you press really hard, you will damage the bone. So an easy way to do this is to simply hold this between 2 fingertips. Push it between the teeth so that it's flat. Roll to the gum, come back till it's flat. Roll to the gum, come back till it's flat. On the inside, you're doing the same thing. As one comes forward on the inside, the handle will start to tap the teeth on the other side. And if you kind of picture what's going on here, when you hit the middle, this handle is going to be kind of stretching the lip going back towards your ear. So at this point, you switch hands or you flip it over and you continue on and finish the rest. On the top, it's the same idea, except now you are rocking up towards the gum. So it's flat up, flat up, flat up. Don't over rock because now you're poking again. So flat up, flat up, flat up. This is a durable tool, but it does wear out. And you can, with normal use, expect 4 to 6 months out of one of these things. But typically we recommend changing it with each professional cleaning. As this wears out, it starts to change. The tip starts to soften. The end of it may start to curl. With use, it may actually even start to shorten. Now, this is not a cleaner. This really should not be used to rub against the teeth to remove plaque. This is for your gums. So if you use it properly, it will last. But you may notice that the tip is start getting shorter and it's time to replace it. When it's not being used effectively, we start noticing changes when patients come in for their maintenance visits. What we notice is that bleeding scores start to rise. The pockets start to deepen again, and it's almost always related to this rubber tip tool. When we make a correction, either in technique or make the patient starts using it properly, daily, effectively, when patients come back the next time, then we start seeing that the bleeding scores start to go down again, the pocket depths start to shrink again, and again, almost always related to this tool. We ask you to do these things twice a day. At bedtime and once during the day. The bedtime is very important. You're going to be lying in bed for a number of hours and the plaque has an opportunity to just blossom. So you want to be very thorough, very meticulous before you go to bed. Now during the day, you don't necessarily have to do all of these things all at the same time. So for example, you can wake up in the morning and brush. You can eat breakfast and floss. If there's a place where you're sitting every day at the same time, you can have a rubber tip there. And you can just sort of get in there and when you have the time, just sort of whip around. It takes 3 to 4 minutes to get around your mouth once you get good at this. So that's not hard or very time consuming. You can eat lunch and use these little pocket versions of the Proxibrush. They call them go-betweens. It's basically the same brush on just a little handle. You can keep this in your pocket or in your purse. Sunstar also makes these things called soft picks. And you can break one off, and it's just a little silicone tip. And it's soft, and you can use this to push food out between the teeth and remove plaque. Kind of a little bit softer version of the Proxa brush. Folks ask us about these picks, flossers, and I have to say that I'm not a really big fan of them. They're kind of limited in what you can do. They're strung pretty tightly in here, so they're kind of hard to wrap around when you're flossing. It's kind of, when they're in line like this, they're difficult to get into the molar areas because the cheek is in the way. They have flossers where the floss part is at a right angle to the handle. Those maybe are a little bit more useful. And so in a pinch, these things are okay, but you're better off mastering flossing by hand. You'll be more thorough and more effective. I also want to emphasize that when you're doing these home care techniques, be gentle. You do not need to be hard. Plaque is soft. And the analogy that I like to make is that if you could shrink your hand down and find a tiny little washcloth and simply wipe your teeth, that's about the effort that it takes to remove plaque from teeth. Now, once the plaque has calcified, once it's turned into what's commonly called tartar, you can't brush that off, you can't floss that off. That needs to be professionally cleaned off. So again, encourage you to be thorough, but not to be too rough, so that you don't unnecessarily traumatize the gums and recede your gums. For our LANAP and laser periodontal therapy patients, there's a little difference in the protocol. For the first 8 weeks after treatment, we really don't want you to start doing this protocol the way we've just described it. Instead, you just do what you've been instructed to do. At the 8-week mark, 2 months after treatment, you can start doing all of the things that we've just shown. Brushing, either by hand or with a power brush, flossing, Proxa brushing, and you can use the rubber tip with one modification. We want you to still do the rocking motion between the teeth, but we want you to avoid tracing with the point under the gum line for the first 6 months after treatment. Why? Because we really don't want you to pull the gum away from the root of the tooth where a new attachment may be regenerating. I want to take the opportunity to show you the packaging that these various cleaners tools come in, so that you know what to purchase. I highly recommend that you make your purchases locally and support our local retailers, drugstores, pharmacies, retail stores. Most of these things are available, but sometimes they're hard to find, and sometimes you need to go online and to purchase them and order them. So I'm giving opportunities here to take some screenshots so that you can save this if you like, and so that you know what to buy. This is the stimulator, the gum stimulator that I mentioned earlier. This is the Proxa brush handle. Typically the bristles, the brushes come in different shapes and sizes. The refills for this come separately. This is the current insert, the current Oral-B brush head that we like. I say current because the company has a tendency to change models, names, colors, but really what you're looking for is just a regular round brush head that does not have any paddles built in or cups in the middle of it. You don't want double brush heads because those are too bulky and they get in the way and are hard to use on the inside. So they will change colors and names, but essentially in principle that's the type of brush head that you want for your Oral-B plaque remover. Now I have a disclaimer also, and that is that although I've done my best to kind of show you in a video format how to properly take care of your teeth. There really is no substitute for hands-on training and coaching. And then after a period of time, say 3 to 4 weeks, a review, a reevaluation of your effectiveness. Because if you're not removing all the plaque from every surface of every tooth every time, well, you're setting yourself up for areas of future disease, both dental disease, cavities, and gum disease, periodontal disease, bone loss. So it is important to work with your dentist, your periodontist, your hygienist to make sure that you are properly implementing these techniques. Because if you can master these techniques, and with practice it really is not that hard, but if you can master these techniques, then you're going a long way towards keeping your teeth in good health, in good function, in comfort for a lifetime.